If you've ever treated or lived with diabetes, this video is a must-watch. By the end, you'll know how to spot early signs of Charcot foot, what makes it so dangerous, and how to protect yourself or your loved ones from its most damaging effects. We often focus on blood sugar, wounds, even amputation risk in diabetes, but there's something else that hides in plain sight. No open wound, no obvious trauma, just a swollen, warm red foot that looks like cellulitis, but it isn't. And if we miss it, we miss the chance to stop one of the most life-altering complications of diabetes. For those who don't know me, my name is Dr. Voltaire, a wound care physician and family medicine doctor. And in my outpatient clinic, I've seen patients walk in with what looks like a sprained ankle or mild infection, only to discover weeks later that they've been walking on a crumbling foot. This is the kind of case that haunts you because the signs were there and we missed them. If you're in primary care, home health, or wound care, this is for you. You don't need an MRI or a specialist down the hall. You just need to know what to look for and how to act fast. Today we'll cover what Charcot foot really is, the early signs most people mistake for something else, a real story from my clinic, and the #1 question I ask when I see a swollen foot in someone with diabetes. Stick around because at the end, I'll give you my 3-second foot check you can use in any setting, even without fancy tools. Let's start with the basics. Charcot neuroarthropathy, or Charcot foot, is a condition where the bones, joints, and soft tissues of the foot break down because of nerve damage, often from diabetes. The bones weaken, the joints shift, and the foot literally collapses from the inside. But here's the thing, it's usually painless. Why? Because the same neuropathy that sets it off also numbs the foot. So the person can keep walking on it, causing more damage without even realizing it. Most of the time, there's a small event that triggers it. A twist, a misstep, even just increased walking. Something tiny that wouldn't normally matter, but in a neuropathic foot, it starts a chain reaction. The body tries to repair the microtrauma, but with poor sensation and circulation, it goes overboard. The result is inflammation, bone breakdown, collapse. It's like trying to fix a squeaky door with a sledgehammer. Let me tell you about Mr. J. He's 64, lives with type 2 diabetes for over 20 years, and walks with a cane. He came into my clinic after being told he had a sprained ankle at urgent care. No wound, no trauma, just swelling and warmth in the left foot. They gave him antibiotics. He said it felt fine, but the swelling wasn't going away. In fact, it looked puffier. The midfoot was broader. I pressed lightly and no pain, but his skin felt hot. That's when the alarm bells rang. This wasn't cellulitis. It wasn't a sprain. This looked like early Charcot. I sent him to podiatry, got offloading started quickly, and sure enough, x-rays showed bone changes already underway. That early recognition saved him months of collapse and probably stopped an ulcer or even an amputation from happening. Here's what to watch for: a swollen foot that's warm to the touch, redness but without tenderness, looks like infection but the person feels fine. Sometimes one foot looks larger than the other. Now here's the key: in early Charcot, the skin is intact. That's what makes it tricky. Most people expect wounds, drainage, or open ulcers to signal danger, but Charcot is quiet. It hides behind normal-looking skin. The biggest mistake is that we wait. We say, let's see how it looks next week. But each day of walking on a Charcot foot is another day of bone collapse. This is one of the few foot conditions where immobilization is urgent, even before imaging. In fact, the gold standard is to offload as soon as you suspect it, not wait for confirmation. So that's what I do. If I suspect Charcot, I get the person off their foot that same day. You might be wondering, who should I be watching more closely? Well, people with diabetes for more than 10 years, known peripheral neuropathy, history of foot ulcers or trauma, chronic kidney disease, or transplant history as well. These are folks where one swollen foot should never be dismissed. Let's talk about why Charcot gets missed. It looks like infection. Also, the patient doesn't complain of pain. It's also rare, so many providers haven't seen it. And here's the kicker: it's often missed multiple times at urgent care, primary care, and even in wound clinic. That's why we need to talk about it more, because if you don't suspect it, you won't diagnose it. As far as imaging goes, yes, we want x-rays and sometimes MRIs, but remember, early Charcot may not show up clearly on an x-ray, so don't let a normal x-ray talk you out of what your clinical gut is telling you. I've had cases where the foot looked Charcot, but nothing showed on the first image. But 2 weeks later, the changes were obvious. That's why your eyes and your instincts are so important. Here's my quick outpatient trick. Have the patient dangle both feet off the table. Compare warmth, redness, and shape. Ask, have you had any injury or new shoes? And then I ask this, if I press here, does it hurt? If the answer is no, but the foot is swollen, warm, and red, I strongly consider Charcot. Let me talk to you, the caregiver or provider who's watching this. You've probably seen that diabetic foot that just doesn't look right. It's not broken, it's not infected, but something feels off. Don't ignore that feeling, because catching Charcot early is one of the biggest gifts we can give our patients. Remember how we started with that mysterious swollen foot? It's not always a sprain. It's not always an infection. Sometimes it's Charcot, a condition that hides behind normal skin and reveals itself only when it's too late. But when we see it early, when we offload quickly, and when we educate our patients, we stop the spiral before it begins. And that's what wound care is all about. Thanks for watching. If this video helped you, check out my next video on how to recognize when a wound is healing or hiding a deeper problem. And if you want more in-depth, real-world training, join us inside the Wound Care Circle. We're building something very special there. Stay informed and heal well.